And we've been talking a lot about artificial intelligence these days, and today we're focusing on the use in the medical industry. And Makovec asked the dean of the Stanford School of Medicine about a new initiative called Raise Health.
Raise Health is an acronym for Responsible AI for Safe and Equitable Health. And what we want to do is first and foremost to establish a repository of data about how AI is being applied in healthcare and biomedicine. There really doesn't exist any such resource today. And by curating and assimilating that information, we hope to drive a discussion on the appropriate framework for the ethical use of AI. Lots of concerns about AI and how it may affect privacy, but also lots of opportunities for AI to improve health and safety in healthcare.
Right, so you have to try to wrangle it in and make it useful and safe as this technology is evolving right in front of our face. What are some of the biggest concerns that you have right now about the use of artificial intelligence in health and medicine?
I think there are several concerns. One certainly has to do with privacy. With large language models and generative AI, even simple queries that don't contain any personally identifiable information, even a simple query, depending upon the database that the large language model brings in, such a simple query could lead to the identification of a person, or at least narrowing it down to a small group of people. So we have to come to grips with that to really understand how privacy needs to be protected when we are now aggregating information from multiple different platforms and making it able to be assimilated in ways that identify individuals and ultimately patients. So that's one concern. Another concern is bias. We know that bias can be introduced if AI models are trained on data which overtly or inadvertently is biased. So understanding the causes of bias and being able to compensate for those is another concern.
Now, are we talking about AI that only doctors would use, trained professionals, or average citizens? You know, there's always the issue with people going to Google with their medical concerns and then coming up with all sorts of crazy diagnoses and anxieties. Myself, I do that all the time. What are we talking about here? Something that people could use, and use it wrong? Or are we talking about this specifically being used within hospitals and doctors' offices?
We want our initiative here to be very transparent and to be very inclusive. And that means inclusive of anyone who wants to access the information that we gather and indeed to get their feedback on how that information is being used and where it can be put to greater use and higher value. I think the reality is that even if we could put these large language models back in a box, we're not going to be able to do that. And they are going to be accessible. They should be broadly accessible. But then helping people understand how to use them wisely, responsibly, and how to gather as much meaningful information as they can from large language models is a major goal. I think overall, the Dr. Google phenomenon has been good, and that people are broadly speaking, much better educated about their health and about determinants of health than before we had search engines available to give us so much information.
Okay, and we've been talking a lot about the negatives, but what are some of the bright sides here? How can AI be used to really revolutionize healthcare?
I think there are many, and I think the positive opportunities far outweigh the negatives, particularly if we plan and deploy AI in a responsible way. For example, already today, we have AI in use in our health systems in checking orders that are entered by healthcare providers to make sure that there isn't a medication error. It's so easy if we're writing or typing in the dose of something, it's so easy to move a decimal point inadvertently. And yet that can lead to catastrophic results if a medication is administered either at a tenfold higher or a tenfold lesser dose than it was intended to be administered. So we already have systems in AI deployed today that detect those errors and issue a warning to the person ordering the medication before it's ever dispensed to the patient. Likewise, oftentimes we're using AI to interpret or help interpret radiological imaging studies. that can be beneficial. If someone comes into the emergency department at 2 o'clock in the morning and they get a chest x-ray and it shows something that's subtle but potentially very dangerous, that AI can trigger that finding and inform a physician right away so that they look at the chest x-ray and make the accurate diagnosis and do the treatment that's needed at that particular time.
All right. Well, you guys are doing some very beneficial work there, trying to wrangle in this technology for good. We certainly appreciate it. Dr. Lloyd Minor, Dean of Stanford School of Medicine, thanks for being with us today.
Thank you very much.
Well, RAISE Health is the joint initiative between Stanford Medicine and the Stanford Institute for Human-Centered Artificial Intelligence, or HAI for short.